it's just knowing that there's a treatment option out there really lifts a weight when it becomes a matter of choice. Yes, I have this food allergy and I choose to continue to avoid the food versus I have the option of treating it, and just knowing that they can play have some sort of conscious choice in how they want to address their food allergy. You can see the weight lifted just letting them know that that option is there.
It really is. I can testify to that personally as a family, but also professionally, having treated someone who we didn't discover in her treatment of panic and anxiety for maybe almost a year of working together. It really became clear that the underlying trauma that she experienced preceding all of the panic and anxiety that she had as a young adult really went back to these hospitalizations from anaphylaxis,
right?
And the amount of hypervigilance that instilled in her,
yes,
that she could not trust her own body, that her body could attack her, that food could attack her, so to speak,
right?
And that we had to do some training and desensitization at a psychological level. So I want to shout out to other treatment professionals in psychology to flag this as an emerging, I think, category of diagnosis that we can look at, sort of some sort of post-traumatic experience that might not normally be in the patient's oral presentation or in their narrative about what things in their life have been stressful. Because as you can tell from our son, but other people, often these kids have to become very responsible very quick, which in itself is not a bad thing, but it does leave a mark, so to speak, as we like to say. It leaves a dent psychologically.
Yeah.
And it's important to catch that.
Yeah, Keith, what's really interesting too is for all of our, I think you'll find this interesting and you'll be able to share with me what it means. But, we have patient intake questionnaires before we offer this treatment just to get assessment of, well, how do your food allergies affect you as a parent and how do they affect your child? And so the, questions are, what's how much anxiety do you have? How much, and scale of 1 to 5, 5 being the worst. It's always level 5. What are some of the things that you worry about? Fear my child might die. 5. With the child, what am I afraid of? Fear of dying. And when they're there talking to you, and you're just meeting and they're discussing, their medical history and their food allergies, these things aren't on the surface. It's only when you have them, they've been living with them for so long that it's not there on the surface, but it must take a real toll and a pretty deep one at that.